not because of a lack of love for these children. It may not even be because there is a lack of access to medical care, though sometimes that is a factor. It is because pain, especially pain in children, is poorly understood. And when pain is misunderstood, it gets sidelined and mismanaged and can cause far-reaching and lasting damage. We'd like to change that. Anna, a pediatric pain psychologist, and Rachel, a health and science journalist with a personal history of chronic pain, joined forces on this book to make clear that children's early experiences with pain matter deeply and can shape future perception of pain and overall development. But our message is not one of doom and gloom. On the contrary, we will demonstrate that adults can do so much more for the children in their lives, and even for themselves, than sit idly by. Whether you are a parent, a grandparent, a medical professional, a teacher, or anyone else who cares for children, you have the opportunity to affect how children respond to and cope with pain. And your influence now can help them throughout their lives. This book will give you the tools to do so and point you to resources that will make managing children's pain a priority. The first step is to acknowledge the need for better pain management. The next steps will become clear as you listen further, and we hope you will be inspired to take them. The neglected sufferers of the pain epidemic. In recent years, the medical community, policymakers, and news media have begun to acknowledge and address the severity of our country's adult pain epidemic. By the latest estimates, some 50 million American adults endure chronic pain, generally defined as pain that persists for more than 12 weeks, which means it affects more people than diabetes, heart disease, and cancer combined. In addition to the enormous physical and emotional suffering that chronic pain causes, it costs the United States over $500 billion in lost productivity and medical treatments each year. It has also helped to fuel a widespread dependence on pain-relieving opioid medications, which are tied to an estimated 130 overdose deaths each day. But adults are not the only ones suffering. An estimated 5% of children in the United States experience moderate to severe chronic pain, annually costing about $19.5 billion. Rachel knows that suffering all too well. After being diagnosed with scoliosis at age 8 and wearing a back brace from ages 8 through 16, she later developed increasingly unbearable backaches, muscle spasms, and pinched nerves as a young adult. Rachel is no stranger to the ways pain can infiltrate your being, one stealthy attack at a time. She also knows the frustration of searching for decades for help from physicians, physical therapists, and all manner of holistic healers, and finding little or no relief. It is a hopeless place to be, and too many people have been there. Why is it so hard for patients to find appropriate help for their pain? For starters, the medical professionals on the front lines, internists, family physicians, and surgeons, have little training in pain management. Unless they specialize in pain, most medical students receive a mere 1 to 6 hours of education in pain management. Veterinary school students are required to have significantly more education in how to alleviate pain in animals than would-be physicians are required to have in treating pain in humans. For many clinicians, then, pain management translates into prescribing pain relievers, such as opioids, which are often ineffective in the long term and are notoriously addictive. But thanks to the efforts of researchers, professional societies, such as the International Association for the Study of Pain and the American Academy of Pain Medicine, patient advocacy groups, such as the American Chronic Pain Association and the U.S. Pain Foundation, and national agencies, such as the Centers for Disease Control and Prevention and the National Institutes of Health, we are slowly starting to recognize the need for better pain management in adults that extends beyond medication. In 2015, government agencies, led by the National Institutes of Health and the Department of Health and Human Services, unveiled the National Pain Strategy.